Hi Mrs. Cassidy. My name is Phil. I'm a dementia specialist nurse in the hospital. I'm going to go over the information your doctor gave you about your mother's condition. I know it was a lot for you to take in.
Yes, it was a lot to take in. The doctor said she has vascular dementia. I didn't even know there were different types of dementia, so I was quite confused.
It can be confusing. The term dementia describes a set of symptoms that can include memory loss, difficulty with thinking processes and communication problems. Alzheimer's disease is the most common form of dementia, followed by vascular dementia, the type of dementia your mother has.
Oh, is vascular dementia different then?
Yes, it is. Vascular dementia is caused by reduced blood supply to the brain, often because the blood vessels are diseased or blocked. The follow-on from this is that brain cells don't get enough oxygen to survive. This death of brain cells is what can cause problems with cognitive function, or the ability to think clearly and reason through problems.
That is certainly what's been happening. She had a stroke a few months ago. The doctor said that may have caused the dementia.
That's right. Vascular dementia is sometimes called stroke-related dementia. Some people, like your mother, can develop vascular dementia within 6 months of having a stroke. Any condition which causes disruption to the blood flow to the brain adds to the risk of developing vascular dementia.
I took Mum to the doctor when I noticed she was getting flustered about things which never used to bother her. She was always such an organized person and very clever too.
It was a good thing that you brought your mother in for an assessment. The early symptoms of vascular dementia usually relate to changes in the thinking processes. This includes the way a person organizes things or makes plans. Some people find they start to have difficulties making decisions as well.
Right. But I thought memory loss was the first sign of dementia?
That's one of the differences between Alzheimer's disease and vascular dementia. People with Alzheimer's disease tend to have short-term memory loss as an early symptom, whereas people with vascular dementia tend to have more problems with thought processes. Despite this, people with vascular dementia can also have a little difficulty remembering recent events.
The doctor mentioned that she may have behavior changes. What did he mean?
Some people experience mood changes, such as apathy, depression or anxiety. It's quite common for people with vascular dementia to feel depressed, especially if they are aware of how the condition is affecting them. Sometimes they have rapid mood swings and may become tearful as well.
Yes, we have noticed this happening a bit lately. As I said before, Mum was a very competent person and ran her own business for many years. She is finding the diagnosis hard to accept. She was asking about her treatment options and couldn't remember what the doctor told her.
I'll go through her treatment with you now. The first part of her treatment is to reduce risk of further strokes. She's taking blood pressure tablets and cholesterol-lowering medication already, which she will continue.
What about a tablet for the dementia? The father of a friend of mine has Alzheimer's disease and takes a tablet for it every day. Can't Mum take the tablet too?
Unfortunately, the tablet used to slow the progression of Alzheimer's disease doesn't help people with vascular dementia.
Is there anything else I can do to help my mother?
Yes, there are some things you can do to improve her quality of life. It will help if she follows a healthy diet and gets regular exercise. She should also moderate her intake of alcohol.
Okay, but what about her mental faculties? How can I help her remain as independent as possible?
There are a few strategies your mother can use to manage the cognitive symptoms of vascular dementia. Your mother will find that breaking complex tasks down into smaller steps will often make them easier. Also, if she stays in an environment which is not too noisy, it is often easier to concentrate. A regular routine is advisable as well.
That would help her organize herself, wouldn't it?
Yes, that's right. It's also important that your mother stays mentally active too. There are some activities which help with this, like writing a life story or making a memory book.
Oh, yes. I've heard about things like this. Someone suggested that Mum might get something out of a memory cafe.
That's a good idea. The last thing is about personality changes. As vascular dementia progresses, changes in behavior becomes more likely. It can be difficult to cope with, especially if a person's behavior changes dramatically. It's usually better not to use medication like sedatives. Talking therapy can be useful and support groups can help as well. I'm going to refer your mother to a community dementia nurse who will visit her and be a good point of contact for you as well.
Thank you. I think I'll need a lot of support as Mum's condition progresses.